not a replacement for formal training. I encourage everyone who's interested in the subject to get formal training because there's a lot that goes into the formal training. You take one of the 4-hour training courses and you can interact with other people, you can do role playing, you see how the whole picture of suicide prevention works together, as opposed to getting a piece here and a piece there. Second, this is a two-part series. It really, knowing the signs does not go far enough. Once you know the signs, you need to know how to ask somebody if they're thinking about suicide. Of course, once you know how to ask somebody about suicide, you need to know what to do if they say they are. And that's where taking the whole class, where you see all the pieces together in one shot and you can interact and ask the questions, is important. Now, the PowerPoint to this video is included in the description part of the video. So if you want the PowerPoint or you want the graphic that shows all the signs in one place, both of those you can download for free, from the description part of the video. If you have questions, please feel free to ask during the comments. This is an important topic. I've searched for videos similar to this, can only find a few, and most of those are not very complete. So I would invite you to like this video and share it with other people you think may be interested in the topic of understanding more about suicide and what to look for. So this video is warning signs that someone may be thinking about suicide. Understand that most people who are thinking about suicide do not want to die. They want to stop the pain, whether it's deep emotional pain, deep physical pain, or a combination of both. I have seen multiple studies of suicide survivors, and they were really large studies. And both the studies show that most people who have tried to end their life thought that they had made it clear to other people that they were thinking of suicide. The problem is they don't come out and say these words: I'm thinking of suicide. I'm thinking about ending my life. I'm thinking about killing myself. It's a little more subtle than that. So when you begin to understand, the ways they communicate it, it becomes easier to notice and recognize that somebody may be thinking of suicide. One of the ways we can do is we can see their struggles by paying attention to what they say, what they do, and what we observe. And these are the three things that you look at in determining if somebody is thinking about suicide. When somebody is struggling with depression, anxiety, or goes through extreme traumas in their life, we need to pay more careful attention. The earlier we notice their words, their actions, or their situations that can lead to suicide behavior, the better the chance of us getting them the help they need so that they can end up living a full and happy life. Now here is the diagram I mentioned that you can download for free. Asking about suicide is based on what you see and hear. It's based on what you hear them say, it's based on how they act, and it's based on what you see. And so I'm going to break this down into individual little sections so you can see it better, but I want you to see the whole diagram. And as I said, you can download this free and put it with any notes or any place that you keep things like this, so you can familiar yourself with those things. Now, the first thing is based on what people say. If they express things about feeling hopeless, life sucks, it's never going to get any better. In fact, the first meeting I had with my mental health support group, there were two brothers there who basically said they don't see their lives ever getting any better. I asked both of them after, in days after the class, were they thinking about ending their life? Because feeling hopeless is one of the top signs. And if you're in deep pain and you don't see that there's any way out, that's a trigger. That's something that suggests to you, pay attention. That all by itself may not be enough to ask the question, but it's enough to make you pay attention to see if there are other signs out there. Feeling trapped. When somebody says that they're being a burden to other people, to their families, that's a significant clue that they may be thinking about suicide. Having no reason to live. You, uh, Expressing that the pain they feel is unbearable. Any type of statement that says that they want to die, or they're thinking about dying, or they'd be better off if they died. Anything like that. I mean, before I was suicidal, and suffering severe depression, I used to tell friends and family that I just didn't care if I lived anymore. I wasn't actively thinking about suicide. Uh, but when somebody says something like that, it's time to pay attention. And anytime they express verbally anything, that suggests self-hatred, you you know, I'm just no good, I'm a loser, that's a warning sign. Now, these things all by themselves may not be enough reason to ask somebody about suicide, but you start getting two or three, and it is time to ask. And the next video in the series that I mentioned, it will be on how to ask somebody about suicide without being offensive, and not being too uncomfortable yourself, because there are easy ways to ask, and I'll share that in the next video. Signs based on how people act. You can notice you know, things that people do that suggest that they may be thinking of ending their life. One of the things is if they start giving away prized possessions. You know, you don't give away the things you love unless you don't think you're going to be around to enjoy them. They start withdrawing from things that they like to do. If I stop, going fishing, then you go, hi, there's something going on with him. You, they have a general loss of interest in things around them. They're sleeping too much or too little. They visit or call people to say goodbye. That one all by itself is enough to ask somebody, are you thinking about suicide? Agitation or anger, especially if they're not usually a person that expresses a lot of anger, or is typically not agitated. You have any of these other signs, and you see them, being agitated at the same time, it's a good time to ask them the question. And signs based on what you see or about them. If they suffer with depression, anxiety, or any mental health issue, they are much more likely to be suicidal. So if you already know that they're suffering depression and anxiety, or they're bipolar, or they're schizophrenic, and they say or do any of the things beforehand that we've mentioned before in this video, it's time to ask them about suicide. Life trauma. I have a video out there on helping a teen avoid mental health crisis. And in this, I document 32 events that can lead to mental health crisis. I'll have a link to that in the description as well. Or sudden calmness or positive change in mood. You have somebody who is depressed and anxious, and suddenly they're not. Well, sometimes that's because they've decided to end their life, and this decision, they found a way out of their pain, so suddenly they feel better. And a lot of times, even when you know somebody is suicidal, they suddenly perk up, and you go, oh, they're getting better. But when I see somebody suddenly perk up, I ask myself, why is the reason? Yeah, they just won the lottery and they suddenly feel perky. Well, that's one thing. But if they've been sad and down and depressed, and suddenly they're not, I'm very likely going to ask them about suicide. I mentioned irritability in the last one. Increased use of drugs or alcohol. Both drugs and alcohol are big precursors to suicide. Drugs and alcohol raise your risk of suicide from 4 to 8 times, depending on the drug that you're taking. And if you know that they've had a previous suicide attempt, because who's attempted suicide in the past are more likely to end their life with suicide now. And every time you try, you you almost always use a more effective means. So uh, if they've tried to commit suicide in the past and they are attempting again, this time they're going to use something that's more likely to end their life in the past. So if you know that they've attempted suicide in the past, you need to pay really careful attention. I have a, a family member by marriage that ended her life uh, within the last year, and she had been suicidal in the past, and we were paying attention, but you know we we missed it. And this time when she attempted, she completed the suicide and passed away. So if you know that somebody's been suicidal in the past, it doesn't mean that they'll for sure that they'll ever do it again. It just means to pay a little more careful attention and listen and watch, and pay attention to the things you hear and see. You, and those are the basics in it. I do invite you to uh, check my description, because not only can you go to my channel and find the video, but I'll have in the description the link to the video on how to ask somebody about suicide. Well, I wish you all the best, and you all have a wonderful day.